Welcome to Wellness Through Physical Therapy. I'm Paula Degnan. With me is Anthony Damiano, DPT. What does that stand for?
It's a doctor of physical therapy.
So you know your stuff.
I hope so.
I think
My
you do.
My professors would be pretty upset if I didn't.
They might, in case they're watching, you don't want them to come and take the degree back. So we're today going to talk about shoulder injuries.
Yeah, we'll talk about the shoulder in general, pain associated with the shoulder, and some common injuries, why they happen, and how we can help with those injuries.
All right, well, let's start with that, Anthony. How can shoulder injuries happen? Because I would think you're out here, but how do you do something up there? Yeah,
so in this area and in a lot of areas where factory work and manual labor is needed, repetitive injuries could cause a lot of damage to the shoulder. There's, really three causes that we kind of address mostly when it comes to shoulder pain. The first one and the most common one would be an impingement syndrome of some sort. So an impingement syndrome just means that the ball inside the ball and socket isn't rotating like it should in a normal mechanics. It's actually sliding or elevating, causing pinching underneath this acromion process that sits on top of the shoulder joint. When that happens, you could get some compression on some muscles, nerves, bursa, a plethora of different structures that can refer pain and whatnot.
So how would something like that happen? Is it possible that things like that could be just genetic?
In a way, but mainly it's kind of caused by strength deficits, stability deficits, and then possibly range of motion deficits, or a combination of any of those three. So when the shoulder isn't moving properly with the proper mechanics, it could cause a lot of, like I said, that impingement on those structures. And over time, that impingement could cause things like tendinitis, rotator cuff tears, both partial and complete, and bursitis. So when you have that constant movement that we have in some of our, day-to-day jobs, where you're working with instruments out in front of you, above you, a lot of overhead work will get those injuries. And if you don't have the proper strength and stability inside that shoulder, it's going to lead to those problems.
When you talk about the repetitive, is that something when you think about pitchers? When they're playing baseball and they have to wind up and that's the kind of thing?
Yeah, so it's that wear and tear, it's that constant movement. So when you're working and you are constantly moving one thing to another, lifting, carrying, whatever it may be, it's never that one thing. It's that one thing over time, hundreds, thousands of times. And usually it's the straw that breaks the camel's back that causes the pain. And then, that's when we see the patient, not when the injury is occurring, actually, after the injury has already happened.
So even the athletes
of course,
can have problems with things like that.
Yep. I looked at a young baseball player not too long ago and checked out shoulder range of motion, which was great. He's about 13 years old, perfect mobility, no problem. And you would see that in a normal 13-year-old. But when I looked at his stability and strength of his rotator cuff and other muscles that sit back in here that kind of do all that shoulder stability, they were weak. And he's been having pain, and this kind of, I was able to let him know, okay, if you do these certain things, these certain exercises, we could stabilize that shoulder joint. It should lead to reduced pain, especially with activity like pitching, etc.
So you mentioned one. Now there are two other ways that we can get shoulder injuries too?
Yeah, due to two other causes, really. One actually has nothing to do with the shoulder. It's referral pains. So people will complain about pain down the arm a lot of times. And it's kind of diffused, so we don't really know where it's at. And a lot of times that's caused by, possibly a nerve pinch in the neck, referring pain down the arm. In these lower cervical segments, if we have a nerve pinch, it will refer pain, or a trigger point referral pattern. So a lot of times people will get knots up in this upper trap area, upper neck area, even into the shoulder blade region. And those types of trigger points will refer pain down the arm. So people think it's their shoulder, but it's actually something different.
All right, and the third?
And the third is our posture. So, yes.
And everybody watching just went,
Yep. So It's very common. We live in a flexion forward society nowadays.
Oh, yeah.
Everything's out in front of us. So we see a lot of rounded shoulders, forward heads, kind of that slouch posture. And do me a favor, go ahead, slouch like that for me. Okay, raise your arm as high as you can. Just one of them. I'm kind of stuck here too.
Yeah.
All right? Now
Yeah.
just sit up nice and tall. Go ahead, raise your arm again. So it goes higher. It's all about positioning, and it's the mechanics of the body. So when we have poor posture and poor strength in this back area, and we can't pull ourselves up, and now we're moving our arm constantly, you'll get that impingement. You'll get that problem causing pain down the arm, damage to some of the muscles and tendons.
All right, Anthony, we're going to take a little break now, and everybody who just saw that is now going to be going, hey, come in here, let's do that. Let me show you what we just learned. And when we come back, we're going to talk more about shoulder pain and what to do about it. Wellness through physical therapy right here. Don't go away. Welcome back to Wellness Through Physical Therapy, and I'm with Anthony here today, and we're talking about shoulders. So how do you identify, because I know you mentioned that there could be something that's really not happening here, but feels like it's happening here. So how would you know?
So, through our examinations and our testing, we should get a pretty good idea of what's going on with the upper extremity of the shoulder in general. And we'll kind of decipher what we think through the subjective history of someone, through their complaints and their symptoms. We'll get a really good idea of what we think is, the causative factor. But, like I said, we get a pretty good idea. It's hard to guarantee, and it's hard to be 100% certain when you're kind of gauging with someone, when you're working with someone, especially when they're in pain, because pain will mask a lot of things and it'll prevent a lot of things from being shown. So, luckily, what we've decided to do here at Fyzical is get into the diagnostic testing of some of these injuries. So, currently, we're doing things like EMGs and nerve conduction studies to figure out if there is nerve involvement coming from the neck or in the shoulder, elbow, hand, wrist, whatever it may be, to make sure we're seeing that end of things. And then we also have musculoskeletal ultrasounding.
Oh.
So unlike our therapeutic ultrasounding, which is for inflammation and trying to heal the tissue, musculoskeletal ultrasounding is just trying to get us an image of
so you can see
joint.
what's going on.
Yeah, so we could literally look into the shoulder complex at different structures based on the reports we're getting from the person, based on our examination. And then we'll use that information, use the musculoskeletal ultrasounding to kind of confirm our suspicions. And just since we've started using that, we've seen a very good success rate. I know that the musculoskeletal ultrasound has a 92% rate of identifying rotator cuff
92.
tears and partial both complete. So, that information is priceless to us because it could change the entire outlook on what we want to do. If we miss something or, like I said, pain is masking something, this kind of gives us the exact identifying factors, what's going on and why is it happening. And then from there we address it.
When we talk about the pain aspect of it, and that's usually what brings a lot of people in to see you. Yeah. I'm having this pain.
Yeah,
I don't want to start taking anything for it. I want to get rid of it. But at the same time, you also have people who will say, but I'm in so much pain, Anthony. How do you expect me to do exercises in order to make all this feel better?
Yeah, so that's a common problem that we see. So we don't force anyone into an exercise program, or we don't force anyone to progress when they're not ready. We'll start everyone off where we think they could tolerate it and what we think is going to be best for that tissue. So, we might just do, a light soft tissue massage. We might use, therapeutic ultrasound, like I said. We might use a laser therapy, our electrical stimulation. There's a bunch of different ways, we can help with tissue healing without actually getting into the exercise aspects. And then once we feel like the patient's, injury has calmed down enough, and they're feeling better, their pain levels aren't as high, well, then we could start into exercising. Now that tissue's calmed down, now it might be more receptive to exercises and training rather than, just throwing someone into it who isn't ready and possibly worsening the problem.
Yeah, because then all of a sudden you've got a whole building going on where it hurts, but I'm doing it and I shouldn't be doing it.
Exactly.
And then what happens on the other side of it where you have, well, I can't do this, Anthony. I've got a baby and it really hurts. So now you're not really getting any benefit.
Yeah.
Is that on the other end of the spectrum where people baby injuries?
Of course. When we have an injury, your sensitivity to that area is heightened. So you might not be, like I said, as receptive to do certain things. But, if we could be gentle enough to calm that area down, relax that tissue, a lot of people will turn around to it. And especially if we educate them on the benefit of it. We found through research that both complete and partial tears of the rotator cuff have a 70 to 80% success rate in conservative rehab.
Without surgery?
Without surgeries, without any corrective measures. So, people are doing well with conservative management when it's done right. And with a 92% success rate of seeing what's going on in a musculoskeletal ultrasound, well, now hopefully our success rates jump even higher.
Well, I think it's important because, again, when people can see, and how rare is it that you can see inside when you can't really see what's going on on the outside.
Yeah.
All right.
Yep.
When we come back, Anthony is going to tell us some more about what we can do when we have those shoulder concerns when we return on Wellness Through Physical Therapy. We're back, Wellness Through Physical Therapy. Anthony is here and he is going to introduce us to the Miracle Wave. That just sounds...
Doesn't it sound nice?
It does, it sounds, but you're actually doing what?
Yeah, so the Miracle Wave is an acoustic wave therapy device. So it's using sound waves to penetrate through the tissue, causing microcavitations at the cellular level.
What?
Yes. Basically, it's expanding and contracting the cells to help with tissue regeneration.
Oh, okay.
It's actually causing a little bit of micro trauma to the area. And you'd think that'd be a bad thing.
I was just going to ask you that.
But it's not. So your body responds well and wants to heal itself when it thinks something's going wrong. Unfortunately, with a lot of our injuries, that'll happen initially, and then it'll halt or stop, and people don't know why. A lot of times it's because you don't allow the tissue to heal, you're not doing the right things to allow the tissue to heal, or you keep doing that repetitive motion that caught you here in the first place. So without proper tissue healing, the body thinks, this is kind of done. It served its parts over. So with something like the Miracle Wave, that it causes that very small micro trauma to the area that you don't even feel. Your body thinks, okay, well, I'm not
done yet.
Exactly. I need to go help this area out.
Oh, okay.
I need to go cause more, blood flow and bring more healing cells to the area to finish that job that it just never got to finish.
Now, you mentioned ultrasound?
Yes. The musculoskeletal or the therapeutic?
The both. Is it? Is
No.
the Miracle Wave ultrasound?
So it's along the same family as our therapeutic ultrasound in the idea about the cavitations. So ultrasound uses sound waves.
Okay.
Now, ultrasound, the therapeutic kind, is pretty low level in most parts, but it's the same premise. It's causing sound waves to go through the tissue, causing those cavitations in the cellular level to help with tissue regeneration and healing. The Miracle Wave, using acoustic wave therapy, is just a stronger version of that. It doesn't take as much time, and it has a kind of a faster turnaround.
So how do you know, you as the person who is doing this to an injury, how do you know when you've achieved, okay, I better stop?
So usually the patient will tell us.
Ah, okay.
Or we'll see through functional testing and pain measurements and whatnot. So if we feel, that we need to continue to help the tissue kind of heal itself, we'll continue to do it. Once we feel like the tissue's healed, we'll kind of back off and really just focus on our strengthening aspect.
All right, focusing on our strengthening aspect with the miracle wave. It's time to meet the miracle wave. I just love the sound of this, Anthony. What are you going to do first?
Yeah, so I'm gonna pretend like you're one of my patients with a very common injury to the shoulder, biceps tendonitis. So the long head of the bicep comes right through here and attaches back here in this part of the shoulder. So it's coming right through this groove that sits like that. So if you just relax right there. And this is a common injury when we talk about impingement syndrome.
And how
because
does
that
this
biceps,
happen?
Yeah, because that biceps tendon sitting underneath that acromion process that we talked about coming off the scapula. And if that head of the humerus, that ball of the ball and socket joint, doesn't move smoothly inside the joint, it's going to raise up and it'll cause impingement and pinching on that tendon.
So is this repetitive?
Yep, and over
okay,
time, it'll
okay.
cause repetitive injury to this area right here. So
Okay.
if you just relax like that,
Sure.
we'll get this thing going. All right.
So that really is like an ultrasound.
Exactly, so we need a medium to kind of give us good conduction, and it helps get the sound waves through. Okay?
Oh, I can hear them.
Yep. So, what's happening is the lead bullets going back and forth through this, kind of hitting this.
Lead bullets?
Just one. And that's what's causing the sound wave. So that's
Okay.
what you hear. I always tell people it sounds like a jackhammer.
Yes.
And it sounds worse than it'll ever feel.
Yes.
Right? Because we'll never turn it up to the point where it's irritating. We want it to be comfortable for anyone.
Okay. All
So,
right.
You just relax. And it's almost like I'm giving you a tattoo.
Oh.
And we keep it moving. We never keep it on one spot because that'll cause too much irritation to one area. So we always want to keep this moving right along the injured tendon.
And
Okay?
I can't feel anything unusual. I
No.
don't feel anything that hurts. Now, I don't have an injury there, but
Yeah.
if I did,
You shouldn't either. You'll feel the pitter patter. You'll feel the
yeah, that's exactly it.
the pushing of the head of it. But other than that, it shouldn't be painful. It shouldn't be irritating. We want to heal the tissue. We don't want to worsen it.
So underneath what's happening now.
So every time you hear the sound of this machine, that's that sound wave going through the tissue, causing those cavitations at the micro level, microcellular level, and promoting healing, bringing blood flow to the area, letting the body know, hey, this area isn't done, healing yet. We need more work.
Well, I tell you, it doesn't feel painful. It actually feels like we could do a whole massage with that, and it would be great.
People have asked that.
And this is the miracle wave, and you
Yep.
can ask for it when you come and see Anthony.
Yeah, of course. And as long as it's something that we feel that will help with that, particular injury, it's definitely something that we're going to add in.
All right, there you go. Miracle wave. We'll have more coming up on Wellness Through Physical Therapy. Welcome back to Wellness Through Physical Therapy, and Anthony has been demonstrating the miracle wave and giving us all kinds of great information. Now, here at Physical Therapy, you are going to be able to bring people in to see all this. When is that happening?
Yeah, so we're actually doing a shoulder workshop on February 22nd, and it's going to be, very similar to the information you got here, but it's going to be a lot more in depth.
Sure.
We're really going to get into the nitty-gritty of, why these things happen, give you the anatomy of the shoulder, really try to educate the viewers to see, kind of explain why, they're having this pain.
And ask your own
Exactly,
questions.
Exactly.
Yeah.
So we're very welcome to any type of questions. We actually will have like a little bit of a meet and greet type deal at the end where you can actually talk to myself or any other therapist who might be in on that day. It is a Saturday, and it's at 10 a.m.
Okay, and one of the other things that Fyzical has now is its own app, which is so exciting. What happens on this?
Yeah, so when we have our patients come in and we feel like they're ready to start a home exercise plan, kind of maintain what they're getting here, on their own, we will send them an email with a link to this app. once they get the email and the confirmation from us, they could scan this barcode, and that will take them to the app. They'll get a password through our email, they'll sign in, and they'll have their own portal.
Oh,
so then,
wow.
we could give them exercises that have video demonstrations, have written explanations of exactly what they should be doing and how often they should be doing it.
So don't forget February 22nd.
February 22nd.
10 a.m. and you can always get in touch with them here either
Yes.
through the app, you can text, you can call,
Yes.
you can send an email. There's
Yep.
all kinds of ways. And this is almost like getting to take Anthony home, your very own app. We'll catch you again on Wellness Through Physical Therapy.